Hello and welcome to this quick demonstration of BiteFX. So first of all, what is BiteFX? Basically, it's a collection of animations and photographs that help you present the concepts of occlusion to your patients. So all the animations are occlusal focused. For example, say you wanted to explain muscle function. You might select this animation and show the function of the muscles opening and closing, and how when the jaw comes together, you'd want to see when the teeth come together, you'd want to see the jaw fully seated. You might take that on and explain how bruxing with the jaw out of joint, you might get a situation where the jaw keeps moving back and forwards, and I can put the animations on continual loop so that people can see repetitive motions like that. You might then, perhaps not so quickly, but then also show them the use of a splint. Here we're showing muscles and hyperfunction, how a splint that you might provide is well fitted, how it's angled just correctly so that it will help the jaw settle back into its fully seated position with the pterygoids relaxed, how even when you're clenching, the pterygoids will be relaxed, how you're going to provide good contacts, how you might provide anterior guidance and canine guidance. So basically your splint is going to be much better than anything somebody could buy, say like a night guard from Walmart and the like. You may not always want to select your animations from our big panel of animations, and so we provided a way that you can construct your own presentations. So for example, I say I wanted to do a presentation on anterior guidance, so I might use our canine guidance animation, our anterior guidance animation, this one here that shows the effects, and then maybe here that shows a breakdown of canine guidance. I might then want to throw in a couple of photographs, say no canine guidance, lack of canine guidance, what that might look like. I've got a couple here that's saying here's a photograph of somebody with canine guidance, someone with anterior guidance, and now I've created my picture, my own presentation sequence. I'd probably give it a name, anterior guidance. And once I've got this set up, then all I have to do is click the first animation in that sequence, I demonstrate it, showing what I want to see in canine guidance, and then I can just use these buttons here to move to the next in my sequence. It's a photograph, I move on to the next animation, explain the animation, and you can see that I can play the animations with this slider control. You'll also notice there's no narration with the animation. That's because this is designed as a clinical tool where you're the expert, explaining exactly what you want to say to your patients, registering when they understand what you've said, and you can quickly move on to the next point. Or you can wait for them to respond and indicate they're interested, now that they've understood the problem, how you're going to fix it. Here's an animation that's showing how you'd expect things to look when you've got canine guidance. On the left, no contact between the teeth, and on the right, some possible effects. I'll just do this very quickly. You can see we're showing effects on nerves, we're showing possible grinding of the teeth, we're showing loosening of the teeth, and we're showing fracturing of the teeth. And then another animation, here we're showing rapid loss of canine protection, molars hitting, getting bone recession here, and then possible abfraction. Concluding with a couple of photographs, and now you see that I've finished my little presentation that I've put together that you saw down here. You might want to give your patients a copy of what you described to them. So what we do is that we have an event log here, and you can see we've actually recorded each event that took place, and I forgot to switch on the recording button. Well, no problem. I can say, well, I actually started my presentation here at Canine Guidance. I'll just throw this in here, call this Demo 3, say, or I could use my patient's name. That's where I started. I can mark the end point, and now I've defined what it was that I showed my patient. This allows you to create a report. You can see there's an introduction. You can type in your own text where we give you some pre-recorded or pre-formatted notes. You can edit those notes. You can put in your own conclusion. And then when you're ready, you can give this report to your patient or just use it for your own patient records. You can email this to your patients. You can print it. You can save it to a file. Here I'm just clicking on the print and preview button to show you what it would actually look like when put in the patient's hand. So a little snapshot of the animation, description of what went on, or the photographs that you showed. And this is over several pages, and so you can page through and see what the patient will get. So that's a quick review of BiteFX. Hope you enjoyed that. If you'd like to try it for yourself, just go to BiteFX.com if you're not already there, and click on the free trial button at the top of the page. BiteFX is easy to use and learn, so have fun with it, and just give us a call if you have any questions.